Liver 1, Da Dun, large pile. This is our Jingwell point. Wood point, therefore it is a Harari point, and the entry point, the first place that we can access the chi of the channel. On the lateral side of the dorsum of the terminal phalanx of the great toe. Right. Between the lateral corner of the nail and the interphalangeal joint. So some texts have it right, 1/10 of a sun proximal to the lateral corner of the nail. Others put it a little more medially on the toe, a little kind of between the two ends of the nail. And that's the spiritual pivot. The Ling Shu is one of the sources that cite the location of the point there, right between the lateral corner of the nail and the interphalangeal joint, specifically on the dorsum of the great toe. Here we go with some of the actions that we discussed. Right, regulates menses, resolves damp heat, promotes smooth flow of liver qi, restores consciousness. It is a Jingwell point after all. Indicated for use in cases of hernia, enuresis, which is bedwetting, or nighttime incontinence, uterine bleeding, prolapse of the uterus, and epilepsy. Right? Uterine bleeding and prolapse of the uterus show us that this point is one of the points that has effect on helping ascend the spleen chi, right? Because the spleen is responsible for holding, the spleen chi is responsible for holding things in its place. So we see prolapse and bleeding. We often think that the spleen is not holding the blood in the vessels, not holding the organs in place. So Da Dun can be helpful. Liver 3, Tai Chang, great rushing. This is our Shu stream point, earth point, and our Yuan source point on the liver channel. On the dorsum of the foot, in a depression distal to the junction of the first and second metatarsal bones. Think of this as the equivalent or the paired point with large intestine 4, right, which is at the junction of the first and second metacarpal bones on the dorsum of the hand. Dorsum of the foot in the depression distal to the junction of the first and second metatarsal bones, right? And the 2 points together make the 4 gates, which strongly circulate qi. Actions of liver 3: subdue liver yang, so it'll help to quell and anchor ascendant liver yang. Expels interior wind, promotes smooth flow of qi, calms the mind, calms spasm. Indications: headache, dizziness, vertigo, insomnia. All could be related to liver yang rising, right? Wind can be part of that picture as well, internal wind. Congestion, swelling and pain of the eye, depression, which can be related to qi stagnation, infantile convulsions, deviation of the mouth related to interior wind, pain in the hypochondriac region related to the smooth flow of qi, as is hernia, enuresis or retention of urine, right? So incontinence or retention of urine, epilepsy, pain in the anterior region of the medial malleolus. This is one of your big points. This is a point that you should know up, down, and sideways, because if you practice using Asian medical techniques or Asian massage techniques, you will be using this point quite a bit. Liver 5, Li Gu, gourd ditch. our low connecting point. 5 sun above the tip of the medial malleolus, on the midline of the medial surface of the tibia. This is felt, this is palpated right along the edge of the bone. And obviously, I will show you this in class, but it is right along the edge of the bone. This is our low connecting point. Promotes a smooth flow of liver qi and resolves dampness. Retention of urine, enuresis, hernia, irregular menstruation, leukorrhea, pruritus vulva, which is vaginal itching, weakness and atrophy of the leg, genital pain or dysfunction. This is one of the points that I was taught was an excellent point for any kind of genital pain or genital dysfunction. Priapism, which is a erection that will not go away, or flaccidity, right? Impotence. Generally, an inability to have an erection can be caused by some kind of retained cold in the system, latent cold or retention of cold pathogen after an external attack. There could be other factors, but priapism, an unending erection, is often caused by heat. Just as an aside and something to know. There's our connecting channel, right? So we see a direct connection into the external genitals, especially in men, from liver 5, our low connecting point, along the lower channel into the external genitals. Liver 8, guguan, spring at the bend. This is our chassi point, water point, and our tonification point. When the knee is flexed, the point is in the depression above the medial end of the transverse popliteal crease, posterior to the medial epicondyle of the femur, on the anterior part of the insertion of semimembranosus and semitendinosus. This is going to put it very close to kidney 10, isn't it? It benefits the bladder. See? Removes dampness from the lower burner, relaxes the sinew, nourishes the liver blood. Indicated for prolapse of the uterus, lower abdominal pain, retention of urine, nocturnal emission, pain in the external genitalia, pruritus vulva, pain in the medial aspect of the knee and thigh. Right, this point, and liver 7, really good for knee pain, medial knee pain. Also used often for nourishing the liver blood, cases of liver blood deficiency. So here we see kidney 10. Yes. And here we see liver 8. Right, here's your semimembranosus and semitendinosus. Between the tendons, we come down to where they distally attach. We move posterior, right, the depression, posterior to the condyle, the epicondyle of the femur. We also see we're picking up some of the tendon of the gracilis as well in this picture. Liver 13, Zongmun, camphor-wood gate, the front mu point of the spleen, influential point of the Zong organs, intersecting point of the liver and gallbladder channels. front move of the spleen, influential point of the song, and intersecting point of the liver and gallbladder channels, on the lateral side of the abdomen below the free end of the 11th rib. Promotes the smooth flow of liver qi, relieves retention of food, and benefits the spleen and stomach. So we see digestive complaints, abdominal distension, borborygmus, vomiting, indigestion, diarrhea, and also pain in the hypochondriac region, the area under the ribs, which is right where this point is. And finally, liver 14, Qi-men. This is the front mu point of the liver, the intersecting point of the spleen, liver, and yin wei mai, yin linking vessel, the exit point on the channel. It's directly below the nipple in the 6th intercostal space, foresun lateral to the anterior midline. Promotes the smooth flow of liver qi, benefits the stomach, cools the blood. Indications: hypochondriac pain, abdominal distension, hiccup, acid regurgitation, mastitis, depression, and febrile disease. Just remember, this isn't the end of the channel, right? Because there's an internal branch from the liver. One branch ascends to meet with pericardium 1 and spread into the lung. The other branch ascends through the diaphragm, traverses the neck and cheek, surrounds the eye, moves over the top of the head to the vertex where it meets the Du channel, the governor vessel, and a smaller branch from the eye descends the cheek from the lower part of the eye and connects with the surface around the lips, surface of the lips. Okay, that is the liver channel of footjueyin. We'll be back shortly with the discussion of the governor and conception vessels, the Du and the Ren.